My name is Kelly Bryan, and this is my video presentation of a newly approved drug called Otiprio. Otiprio is made by a company called Otonomy, which is located in sunny San Diego in my home state of California. Otiprio is also known by its fancier name, ciprofloxacin otic suspension. Cipro is a fluoroquinolone antibacterial known to be effective against both gram-negative and gram-positive bacteria. Otiprio is a preservative-free, sterile, otic suspension of 6% Cipro in a neutral pH buffered isotonic solution. Here is a list of the inactive ingredients. The only one we care about is polyoxymer 407, unless of course you have an allergy to one of the others. The reason we care about polyoxymer 407 is that it is thermosensitive. It acts as a liquid at or below room temperature and as a gel when warmed. This means that Otiprio is drawn up as a liquid, but when warmed by the patient's body temperature, it will become a gel. Otiprio is indicated for the treatment of pediatric patients with bilateral otitis media with effusion undergoing tympanostomy tube placement. It is administered by the physician after suctioning the middle ear effusion during tube placement. Otiprio is approved for patients ages ranging from 6 months to 17 years. It is not approved for patients under 6 months of age. The safety and effectiveness could not be determined as tubes are not routinely placed in this age group. Otiprio is also not approved in patients over the age of 17 years. This is likely due to the same reasons. No studies were performed during pregnancy, but the risk is expected to be minimal due to the negligible systemic exposure. Yikes! We will not even begin to get into this problem. The dosage is a single intratympanic administration of 0.1 ml or 6 mg dose into each affected ear. Otiprio should not be used in patients who have had a reaction to Cipro, other quinolones, or to any of the components of Otiprio. Warning! There is a potential for microbial overgrowth. There were no interactions listed for Otiprio. This is likely due to the unique intratympanic administration. Adverse reactions are limited: nasopharyngitis, irritability, and rhinorrhea, all less than 5% of the time. Otiprio comes as a kit, similar to the way vaccinations do. Each box contains 1 ml of the drug in a single-use vial, along with 2 preparation needles and 2 administration needles. Otiprio should be stored at 2 to 8 degrees Celsius to prevent thickening. Patient education should include informing the parents that there may be drainage from the ear for the first few days following tube placement. All of the information for this presentation was found at www.otiprio.com. Thanks for watching and have a good day.